which again I discussed last time, is that, you know, we have a finite amount of staff, and most ICUs, there's one nurse to two patients. And so you already have an ER ratio of 4-to-1, and sometimes because of the critical nature of the patient, a nurse may be pulled to do 1-to-1 for that patient. So every ICU patient that's there potentially makes the nurse ratio higher for the other nurses in the department. And so you're getting subpar care.
We have met with Terry and his group, and we have looked at how can we go ahead. The HUD thing would take us, as I told you last time, 3 to 4 years to get the hospital here by the time it is all done. But we really can't wait for our ICU beds for that period of time. So we are looking at doing an expansion or a renovation. And some of you were talking about renovating. Yes, we're going to renovate part of that hospital.
I've never paid much attention to the Waller County Hospital District for a long time because I mistakenly, it turns out, assumed that my friends and neighbors would run our business the same way they run their private businesses. I promise you that if any one of you received a ledger sheet from your accountant in your private business that had a line item that said $300,000 for legal fees, you would hit the wall.
Is HUD oversight and servicing performed on-site or remote? If on-site, will there be additional fees for travel and lodging? Number 3, according to the presentation that this board in May, the approval process requires 2 books in the first round, then a 3rd book in the next round. Book 3 includes design and specifications so that it is shovel-ready. Mr. Jennings estimated $150,000 for this. How long to get a design from the architect? And will a geotechnical report be included? Number 4, as an alternative to building new, what is the cost to convert existing hospital rooms to ICU use according to current code standards? And how many ICU rooms are needed? In June, you still didn't know. Number 5, during the May presentation, Mr. Jennings mentioned that HCA, in its first quarter report, announced it is not planning new construction, but rather will focus on buying existing healthcare facilities. Has there been any response by this board to that information provided to you by Mr. Jennings?
For y'all to get those audio recordings of the previous meeting available to the public. This goes back to January. So 5 months ago, your attorney sent in a letter to me that said the district is currently working on the creation of a file sharing system in order to share these recordings electronically. Pretty much every 3rd grader knows how to upload an audio file to a public platform. So either in 5 months, y'all weren't really working on this and I got lied to, or we have an absolutely jaw-dropping level of incompetence.
NFHA pre-application package. This item raised several questions for me, and probably more I haven't even thought of yet, because I'm trying to figure out when it was determined that the board would be authorizing the submission for the application package. Because at the last meeting, according to your own minutes, you stated that we're in the working stages of this and we'll continue to look, and then went on to say that this was just starting to be discussed, and that when we complete all our discussions, we'll present the plan, which kind of, I know, piggybacking off a little bit of what Mrs. Reeves was talking about. So I guess for me, am I to understand correctly that on June the 23rd, it wasn't even determined that this was the direction that the board was going to be going, and now with no other public meetings between June 23rd and this evening, without any public meeting being held, we've gone from, we're going to look into all the options, we're going to have discussions, we're going to present a plan, and we've just gone straight to, we're going to submit an application package.
We've been meeting with Terry and his group to see what is the number that we need to have here in this community to enlarge. We have 6 right now, which are, Terry told you, 83% full through the year. Yes, 83% full all of the time. So the number of the beds has been determined. It's going to be between 10 and 12 more beds, not the it's counting the 6. It's gonna be 10 to 12, and it's gonna depend, the 10 to 12, on the square footage that we can see if we can get 12 in, or if we're gonna be limited maybe to the 10. But the location has also been determined, and that's going to be in the area where the administration is now, on that side of the building, and they can move administration upstairs, they say, and they can expand that area out there and have that, and it would also be closer if you do build some new facility there, would be on that side.